I grew up in Texas, out in the country, and so for some reason, I always wanted to be a doctor. And a little girl in this little town saying I wanted to be a doctor was a little strange, to put it mildly, but that's what I used to say. And I think I like to take care of things and like to take care of animals and so on. And so I thought that I would be a nurse because I didn't know you could be a doctor. And then I began to say, well, why would I want to take orders from a doctor if I could be a doctor? So I began to, move towards, well, that would be more fun. And I got a lot of support from my parents, a lot of skepticism from others. I would have never thought I would have ended up in psychiatry. It was the last thing I would have thought of. But I rotated through various services as a rotating internship, which doesn't exist anymore. But I found it fascinating. And then I really got interested in, well, how do psychologically healthy people face adversity, like a serious illness that threatens their whole life, their family's life. And I kind of felt that was really what really interested me, and there was no other background to study that except psychiatry. So I did psychiatry and then met Jim along the way, and went to Boston, and then from Boston to Buffalo, where he was at Roswell Park. And from there, the rest is history. When we first married and the cooperative group was really just getting going, we were in Buffalo, and it was pretty common that since there weren't many restaurants around, the scientists would come to our house and have dinner, and it was part of our family evening meals to have people around. And I heard a lot about the research going on. I was home with kids because we had 5 children pretty rapidly, and I worked part-time, but not very much. But I would say to them and to Jim, well, how do the people feel about all these treatments that you're giving them? And what do they feel about being in a clinical trial? And the answer I got was, well, we're too busy trying to cure this disease. Don't hassle me about that. But I'd say, look, you check their urine and their blood, and every orifice gets checked, but I don't see anywhere you're finding out what they feel about all this. So I kind of vowed, when our kids got a little bigger, that was really what I wanted to study. I was very lucky to be asked to, when our kids were a little bigger, to be asked to work at and take on developing the first psychological services for patients at Memoriam Sloan Kettering. And I think that was a real opportunity because it's kind of a flagship of cancer centers. And when we were able to show a need and show that this was an important service within a cancer institute, that other places began to do it. I'm grateful to the AACR, and particularly Marge Fody, for saying, yes, of course, the psychiatric, psycho-oncology issues are important. And so I've been a welcome member to this club, which I think was when I started in the field, I don't think there would have been any such likelihood of such invitation. But I think I felt welcome and been able to bring this perspective to the AACR. The supportive care, so that's palliative care, it's psychosocial care, these aspects have to be researched further too. How do we help people get through this experience to get not only the best quality of life, but the best survival from it? And all the good cures in the world are no good unless a person's up to taking them. So adherence to treatment is a tremendously important issue of cancer care, and that depends an awful lot on supportive care of various sorts.